Understanding depressive disorders impacts and implications. A comprehensive look at the spectrum of depressive disorders and their effects on individuals' social, emotional, and academic lives by William Burdick. Introduction to depressive disorders. Definition. Depressive disorders are a category of mental health disorders characterized by persistent feelings of sadness and a loss of interest in activities that were once pleasurable. These disorders significantly impact an individual's mood, thoughts, and behaviors. Depressive disorders affect how an individual thinks, feels, and functions in day to day activities. They go beyond temporary feelings of sadness or having a bad day. Depressive disorders are complex and multifaceted, involving various biological, psychological, and environmental factors. They are not simply a result of a personal weakness or lack of willpower. Depressive disorders require recognizing the significant impact they can have on an individual's lives and the importance of addressing them as a legitimate medical condition. Depressive disorders umbrella. There is a range of specific disorders that fall under this category, including major depressive disorders, persistent depressive disorders, dysthymia, and others like postpartum depression and seasonal affective disorders, etc. Major depressive disorders, MDD. It is the most common form of depressive disorders characterized by persistent intense feelings of sadness, loss of interest, and a significant impact on daily functioning. Persistent depressive disorders, dysthymia. It involves chronic depressive symptoms that last for at least 2 years. Individuals with dysthymia may experience a milder but long-lasting form of depression. Other subtypes. There are other depressive disorders, such as postpartum depression occurring after childbirth, seasonal affective disorders associated with changes in seasons, and others. While these disorders may have a different presentations, they all share the same common features or persistent, debilitating feelings of depression. Common signs and symptoms. Persistent sadness or a feeling of emptiness. Individuals with depressive disorders often experience a deep and prolonged sense of sadness, which may be present most of the time. Loss of interest and pleasure in activities. A hallmark symptom is the loss of enjoyment or interest in activities that were once pleasurable, such as hobbies, socializing, and spending time with loved ones. Feelings of hopelessness, guilt, and worthlessness. Depressive disorders can lead to negative thoughts and beliefs about oneself, including feelings of hopelessness, excessive guilt, death, or diminished sense of self worth. Trouble sleeping or changes in sleep patterns, insomnia, hyperinsomnia, excessive sleepiness, or changes in sleep patterns are common symptoms of depressive disorders. Common signs and symptoms continued. Loss of energy or fatigue. Individuals with depressive disorders often experience a significant decrease in energy levels, leading to feelings of constant fatigue or lack of motivation. Difficulty concentrating or making decisions. Depressive disorders can impair cognitive functioning, making it challenging to focus, remember information, or make decisions. Changes in appetite or weight. Depressive disorders may cause a decrease or increase in appetite, leading to noticeable changes in weight. Physical symptoms. Some individuals with depressive disorders may experience physical symptoms such as headaches, stomach aches, and other unexplained aches and pains. Note, these symptoms may not be present in every individual, and the severity and combination of symptoms can vary. Social impact of depressive disorders. Depressive disorders can have a significant impact on an individual's social interaction and relationships. Isolation. Individuals with depressive disorders may withdraw from social activities and isolate themselves from friends, family, and social gatherings. Struggles with maintaining relationships. Depressive disorders can make it difficult to sustain healthy relationships. The individual may have challenges expressing emotions, participating in social events, or maintaining regular communication. Impact on family life. Depressive disorders can strain family dynamics, leading to conflicts, misunderstandings, and disrupting routines. Family members may struggle to understand the individual's experience, and this contribute to added stress. Social impacts of depressive disorders continued. Stigma and misunderstandings. Social stigma surrounding mental health can further isolate individuals with depressive disorders. Misunderstandings and misconceptions about depressives can lead to judgment, discrimination, or lack of support from others. Work or school difficulties. Depressive disorders can affect performance and attendance at work or school. The individual may struggle to meet expectations, leading to increased stress and potential negative consequences. Lack of participation in social activities. Individuals with depressive disorders may lose interest in previously enjoyed activities or hobbies, leading to reduced engagement in social events or group activities. Emotional and academic impacts. Depressive disorders have a profound impact on individuals' emotional well-being and can significantly affect their academic performance. Emotional toll. Individuals with depressive disorders may experience persistent feelings of sadness, emptiness, or hopelessness. These emotional struggles can make it challenging to find joy or experience positive emotions. Lack of motivation. Depressive disorders can diminish motivation levels, making it difficult for individuals to engage in academic tasks or pursue their goals. The lack of drive can hinder productivity and achievement. Difficulty concentrating. Depressive disorders can impair cognitive function, leading to difficulties in focusing, retaining information, and concentrating on tasks. This can be negatively affected on academic performance and learning abilities. Emotional impact continued. For performance, the impact of depressive disorders on motivation, concentration, and overall emotional well-being can lead to decreased academic performance. Individuals may struggle to meet deadlines, complete assignments, or perform at their usual level. Increased absences. The symptoms of depressive disorders, such as fatigue and lack of motivation, can contribute to increased absences from school or work. This can further hinder academic progress and create challenges in maintaining regular attendance. Emotional instability. Depressive disorders can lead to emotional instability, with individuals experiencing rapid shifts in mood or heightened sensitivity to negative experiences. This emotional violation can disrupt concentration and make it difficult to engage effectively in academic settings. Specific needs of individuals with depressive disorders. It is important to recognize and addressing the specific needs of individuals with depressive disorders to support their well-being and academic success. Understanding patients, peers, educators, and support network should strive to understand the challenges faced by the individuals with depressive disorders and offer patients empathy in their interactions. Therapy or counseling. Many individuals benefit from therapy or counseling to address the underlying cause of depressive disorders, developing coping strategies, and work towards recovery. Medication. In some cases, medication may be prescribed to manage symptoms and support individuals in their treatment journey. It is crucial to emphasize that medication should be prescribed and monitored by qualified healthcare professionals. Specific needs of individuals with depressive disorders continue. Flexible scheduling. Individuals with depressive disorders may require flexibility in their academic schedules to accommodate therapy sessions, medical appointments, or periods of increased need for self-care. Additional academic support. Some individuals may benefit from additional academic support, such as tutoring, study skills assistance, or accommodations like extended time for assignments or exams. These measures can help mitigate the impact of depressive disorders on academic performance. Creation of a supportive environment. Peers, educators, and institutions should foster a supportive, inclusive environment that promotes mental health awareness, reducing stigma, and encouraging open communication. Collaboration with mental health professionals. Collaboration between educators, mental health professionals, and family can ensure a comprehensive and coordinated approach to support individuals with depressive disorders. Effects on development and success. Depressive disorders, when left untreated or poorly managed, can have a significant impact on an individual's personal development, academic performance, and career trajectory, and overall life satisfaction. Personal growth. Untreated depressive disorders can hinder personal growth and self fulfillment. The constant struggle with symptoms and emotional challenges may impede the individual's ability to explore their interests, pursue goals, and develop a sense of identity. Academic and career impact. Depressive disorders can disrupt academic progress, leading to lower grades, missed opportunities, or even dropping out of the educational programs. In the professional realm, it may affect job performance, career advancement, and overall job satisfaction. Interpersonal relationships. Depressive disorders can strain relationship with family, friends, and romantic partners. These difficulties in expressing emotions, participating in social activities, or maintaining constant communication can lead to strain and isolation. Effects on development success continue. Reduced quality of life. Depressive disorders can diminish an individual's overall quality of life. Persistent sadness, loss of interest, and impaired functioning can significantly impact day-to-day experience, social interaction, and overall life satisfaction. Increased risk of other health issues. Individuals with depressive disorders may be at a higher risk of developing other health problems such as substance abuse, anxiety disorders, and physical health conditions. The interconnected nature of mental and health and physical health underscores the importance of early interventions and comprehensive care. It is important to have early diagnosis, intervention, and ongoing management of depressive disorders to avoid these potential long-term consequences that can arise when depressive disorders are not addressed effectively. Strategies for support. Fostering open communication. Encourage open and non-judgmental communication channels where individuals feel comfortable discussing their experiences, concerns, and needs. Promote a supportive and inclusive environment. Create an environment that values mental health and supports individuals with depressive disorders. This includes raising awareness, reducing stigma, fostering empathy and understanding among peers, educators, and communities. Encouraging professional help. Advocate for seeking professional help such as therapy or counseling and providing information about available resources and mental health services. Provide access to mental health resources. Share information about local mental health resources, helplines, support groups, and online platforms where individuals can seek additional support. Strategy for support. Continue. Implementing accommodations and flexibility. Work with educators and institutions to provide necessary accommodations such as flexibility, scheduling, extensions for assignments, or modify workloads to support individuals with depressive disorders in their academic pursuits. Educate about mental health. Incorporate mental health education in curricula, workshops, or awareness campaigns to enhance understanding, reduce stigma, and promote self-care strategies. Involve family and other stakeholders. Encourage involvement and support from family members, friends, and other support networks to provide a strong social support system for individuals with depressive disorders. In conclusion, understanding depressive disorders is vital for creating a supportive environment. They extend beyond temporary sadness, impacting social interactions, emotional well-being, and academic success. Open communication, mental health education, and support facilitate thriving. Early intervention, professional help, and a compassionate network make a difference. Let's reduce stigma and provide resources for a brighter future. Thank you.